Your doctor has asked that you watch this video before you take a test to find out if you have an infection in your stomach with a bacterium called Helicobacter pylori. Before I describe how the test is done, I would like to give you some information about this bacteria. The relationship between stomach ulcers and Helicobacter pylori, or H. pylori as it is sometimes called, was discovered by two Australian physicians, Robin Warren and Barry Marshall, in 1982. Most stomach ulcers and other stomach pain were found to be caused by this bacteria. Dr. Marshall led the fight to try to convince other doctors that this was true. After years of trying to persuade anyone who would listen, the tide began to turn, and recognition of this bacterium led to a whole new way of testing and treating patients with stomach problems. Fortunately, you have chosen a healthcare professional who understands the need to test for H. pylori. This bacterium is truly unique. For years, researchers and physicians believed that no bacterium could live in the extremely strong acid that is produced in the stomach. Because H. pylori makes an enzyme that neutralizes the stomach acids, it could not only live, but could thrive and reproduce very rapidly. Thus, the lining of the stomach became the home for H. pylori. Dr. Marshall was convinced that if you would get rid of the bug, you would get rid of the ulcers and the pain. He was so convinced of this that he personally drank some of the bacteria to infect himself. He then took antibiotics, killing the bacteria, proving his theory correct. It is now recognized by the medical community that Barry Marshall's theory was absolutely right. Helicobacter pylori is one of the most common infections in humans. It has been recognized by the National Institutes of Health and the World Health Organization as a highly infectious bacterium. Companies are developing tests for diagnosing and drugs for treatment of this bacteria at an extremely fast rate. TriMed Specialties, the company that brings you this test, has been in the business of testing H. pylori longer than any other commercial organization. TriMed introduced one of the most accurate tests for H. pylori in 1988, and it is still considered the test by which all other tests are judged. This test has been used in more than 5 million patients in the United States alone. However, this test requires an endoscopy. This is a complicated procedure by which your doctor can look at your stomach by sliding a long tube with a video camera attached down your throat and into your stomach. New technology has been developed to offer you a test that is accurate and much more comfortable. You simply swallow a capsule and later blow up a collection balloon. The name of this new test is PYtest, an abbreviation for pylori test. Before you schedule a time to take this test, you should be aware of the following points. 4 weeks before the test, you should not take any antibiotics, things like penicillin or erythromycin. You should not take any Pepto-Bismol or any other pink bismuth medication. 2 weeks before the test, you should not take any medication called Prilosec or Prevacid or any other proton pump inhibitor. You should not take any medication called Carafate or Sucralfate. If you have recently taken any of these medicines, you should let your doctor know at the end of this video. 6 hours before the test, you should have nothing to eat or drink. If you must take medications, you may take them with a small amount of water at least 1 hour before the test. I would now like to show you how the test is done. You will be given a capsule to swallow with a small amount of warm water. 3 minutes after you swallow the capsule, you will be given another small drink of warm water. 10 minutes after you take the capsule, you will be asked to take a breath. Hold it for about 10 seconds and then blow up a small balloon. This balloon is very easy to blow up, unlike a regular rubber balloon. It is that simple. Your breath sample in the balloon will now be tested to see if you have H. pylori. I would like to briefly show you how the test works. After swallowing the capsule, it will settle in your stomach. After a few minutes, the capsule will dissolve. The capsule contains many sugar beads coated with carbon-14 urea. If you are infected with H. pylori, these bacterium will digest the carbon-14 urea and break it down into labeled carbon dioxide and other chemicals. This labeled carbon dioxide is absorbed into your bloodstream, taken to your lungs, and then exhaled in your breath. We can then test your breath sample to see if the labeled carbon dioxide is present. If you do not have H. pylori in your stomach, the chemicals in the capsule will be released unchanged in your urine. The importance of the safety of PYtest should be discussed. This test contains an extremely small amount of radioactive material called carbon-14. Scientists commonly use carbon-14 in carbon dating to figure out how old something is. Carbon-14 is found everywhere on Earth. Your body absorbs carbon-14 every day. Unless a person is exposed to a large amount, it is considered safe. The Food and Drug Administration and other agencies that control the use of carbon-14 have stated that this test is safe. In fact, you would have to do this test 60 times in a row to get as much radiation exposure as one chest X-ray. Another comparison is that you would get the same amount of radiation from this test as you would from drinking 15 glasses of orange juice. As you can see, this test is very safe. Your doctor would not ask you to take this test if he or she felt it was dangerous. To summarize, this test is safe, quick, accurate, and inexpensive. In the future, this is how all tests should be. TriMed and your doctor bring you the future now with the PYtest, an accurate and simple way to diagnose H. pylori infections. Thank you for taking the time to watch this video. And by the way, if you had started the PYtest at the beginning of this tape, you would be finishing the test in just a couple of minutes.